High liver enzyme levels can indicate liver inflammation or damage, though they can also be elevated by other factors. A variety of conditions, medications, and lifestyle choices can contribute to that. Your doctor may have tested your AST, ALT, ALP, or GGT liver enzyme levels. These are all different liver enzymes. When they are high, you want to find out why. Fatty liver disease is the main cause of elevated liver enzymes. Research shows that between 25 and 51% of people with elevated liver enzymes have this condition. It comes in two main types, alcoholic and non-alcoholic. Non-alcoholic fatty liver disease, called NAFLD, MASLD or metabolic dysfunction-associated steatotic liver disease, happens when too much fat builds up in your liver cells. It is normal for your liver to have some fat. But if more than 5 to 10% of your liver's weight is fat, doctors call it fatty liver. Studies show that the overall rate of MASLD in the population is about 36.4%. Among people who have MASLD, about 35.9% have abnormal liver enzyme levels. People who are overweight or obese are more likely to develop it. The same goes for those with diabetes, high cholesterol, or high levels of fats called triglycerides in their blood. These health issues together are known as metabolic syndrome. Rapid weight loss and poor eating habits can also lead to fatty liver disease. However, some people get fatty liver even without these risk factors. What about symptoms? Many people feel nothing at all. But some people may feel tired. You might have pain on the right side of your belly. Number 2. The second major cause of elevated liver enzymes is alcoholic liver disease. This happens when drinking too much alcohol damages your liver over time. Alcohol use has gone up during the COVID-19 pandemic, which has added to liver problems in the last decade. Your liver breaks down most of the alcohol you drink. But this process creates substances that can damage liver cells. Over time, drinking too much can lead to fatty deposits, inflammation, and eventually scarring of the liver. Number 3. Viral hepatitis is another important cause of elevated liver enzyme levels. Hepatitis simply means inflammation of the liver, and several viruses can cause it. The main ones are hepatitis A, B, C, and D viruses. But other viruses can affect your liver too, including Epstein-Barr virus, which causes mono, cytomegalovirus, herpes simplex virus, and varicella zoster virus, which causes chickenpox and shingles. How common is viral hepatitis in people with abnormal liver tests? One research found that about 1.1% of people in primary care with abnormal liver function tests had chronic viral hepatitis. This is only slightly higher than the general population rate of 0.7%. Viral hepatitis can cause mild to severe symptoms. You might feel tired, lose your appetite, have a fever, feel nauseous, or notice your skin or eyes turning yellow, which is called jaundice. Some types of viral hepatitis get better on their own. But others can become chronic and need treatment. Wait, there is more, but do not forget to hit the like button if you think this video is useful. Number 4. Medications are a common but often overlooked cause of elevated liver enzymes. Both prescription and over-the-counter drugs can affect your liver. Common medications that can raise liver enzymes include antibiotics, pain relievers like acetaminophen, cholesterol-lowering drugs like statins, some heart medications, and certain psychiatric drugs. In most cases, the liver enzymes return to normal when you stop taking the medication. But sometimes the damage can be more serious, especially if you take more than the recommended dose. Several heart medications can cause higher liver enzymes. Statins, which are used to lower cholesterol, are well known for this effect. Examples include atorvastatin, simvastatin, pravastatin, and lovastatin. Mild increases in liver enzymes happen in up to 3% of people taking statins, but serious liver injury is very rare. Most people will not have symptoms, and the enzyme levels often go back to normal even if you keep taking the medicine. But if the increase is more than 3 times the upper limit of normal, your doctor may suggest stopping the statin. Amiodarone, a medicine used to treat abnormal heart rhythms, can also raise liver enzymes. Up to half of people taking amiodarone long-term may see their liver enzymes go up, but this usually does not cause serious problems. Your doctor will often check your liver tests while you are on this medicine. Other heart medications like diltiazem, a calcium channel blocker, have been linked to liver enzyme increases, especially when used with statins. But this is not common. Most of the time, these changes are mild and do not mean your liver is damaged. But if you notice yellowing of your skin or eyes, dark urine, or pain in your upper right belly, tell your doctor right away. Your healthcare team will check your liver tests if you are on these medicines, especially if you have other liver risks. Number 5. Autoimmune liver diseases happen when your immune system mistakenly attacks your liver. These include autoimmune hepatitis, primary biliary cholangitis, and primary sclerosing cholangitis. They are less common than the causes we have talked about so far. But they are important to identify because they need specific treatments to control the immune system and protect the liver. Number 6. Some people are born with genetic conditions that affect their liver. These include alpha-1 antitrypsin deficiency and hemochromatosis. In hemochromatosis, your body absorbs too much iron, which builds up in the liver and other organs. In alpha-1 antitrypsin deficiency, you lack a protein that protects the liver and lungs from damage. Both conditions can lead to elevated liver enzymes and, over time, more serious liver problems. Number 7. Diabetes, especially type 2 diabetes, is strongly linked to elevated liver enzymes. One research found that on average, 63% of people with type 2 diabetes had abnormal liver enzymes. Compare this to only 32% of healthy people. This makes sense because diabetes and fatty liver disease often occur together. Both are related to insulin resistance, where your body's cells don't respond normally to insulin. How common are elevated liver enzymes overall? One research detected them in almost a fifth of all participants. The most frequent abnormality was increased ALT levels, which affected 20% of people. In a primary care research, non-alcoholic fatty liver disease accounted for over 25% of unexpected abnormal liver function tests. Your doctor might repeat the blood tests to see if the elevation is persistent. Research shows that liver enzyme levels can vary naturally. In one research, more than 30% of people with initially high AST or ALT levels had normal results when tested again about 18 days later. This means a one-time elevated result doesn't always signal a problem. But persistent elevation usually needs more investigation. If your liver enzymes remain high, your doctor might recommend additional tests. These could include more detailed blood tests, imaging studies like ultrasound, or sometimes a liver biopsy, where a small sample of liver tissue is removed and examined under a microscope. For most people with mildly elevated liver enzymes, fatty liver disease, either alcoholic or non-alcoholic, turns out to be the cause. According to the National Health and Nutritional Survey, the point prevalence of fatty liver is about 23% among adults. What should you do if you have elevated liver enzymes? The answer depends on the cause. But some general advice applies to many situations. If alcohol is contributing to your liver problems, the most important thing is to reduce or stop your alcohol intake. Your liver has amazing healing powers, and cutting out alcohol gives it a chance to recover. For non-alcoholic fatty liver disease, losing weight gradually can help. Even a modest weight loss of 5 to 10% of your body weight can reduce the amount of fat in your liver and improve liver enzyme levels. Eating a healthy diet with lots of vegetables, healthy fruits, whole grains, and healthy fats is important. Regular exercise helps too, both for weight management and for improving how your body uses insulin. If medications are causing your elevated liver enzymes, your doctor might adjust your dose or switch you to a different drug. Never stop prescription medications on your own, though. Always talk to your doctor first. For viral hepatitis, treatment depends on the type. Hepatitis A usually gets better on its own. But hepatitis B and C might need antiviral medications. The good news is that we now have very effective treatments for hepatitis C that can cure the infection in most people. Autoimmune liver diseases usually need medications that suppress the immune system. Genetic conditions like hemochromatosis have their own specific treatments. Should you worry about elevated liver enzymes? It depends on how high they are and what's causing them. Mildly elevated enzymes are common and often don't signal serious liver disease. But they shouldn't be ignored either. They can be an early warning sign that gives you a chance to make changes and prevent more serious problems. Number 8. Elevated liver enzymes can also be caused by heart and diabetes risks. One research found that people with fatty liver disease and elevated liver enzymes had a 9 to 29% higher risk of dying from any cause, heart disease, or diabetes complications compared to people without fatty liver disease. This means finding and addressing the cause of elevated liver enzymes might protect not just your liver but your overall health. Remember that your liver is remarkably resilient. It can repair itself to some extent, even after years of damage. So, making healthy changes now can make a big difference, even if you've had elevated liver enzymes for a while. Talk openly with your doctor about your concerns and questions. Ask what your specific liver enzyme levels mean and what additional tests might help find the cause. Work together to create a plan that addresses the underlying issue and helps get your liver enzymes back to normal. Your liver does hundreds of vital jobs that keep you healthy, from cleaning your blood to making proteins and helping digest food. When your liver enzymes are elevated, it's like your liver is sending a message that it needs some help. By listening to that message and taking action, you can help your liver continue to do all the important work it does for you every day. So if your doctor says your liver enzymes are elevated, try not to panic. For most people, the cause is something that can be addressed with lifestyle changes or medical treatment. Your elevated liver enzymes are giving you valuable information about your health. Use that information to make positive changes that will benefit not just your liver but your entire body. Do not forget to click the like button and subscribe. On the screen, you see an essential video for you. Thanks very much for watching this video. See you in the next video.